right, 25 minutes before 11 o'clock. It was probably a year or two ago, Robin, that I went with my son Alex over to Ocala Eye, and he had his LASIK eye surgery, and I stood there like a nervous parent watching that big TV screen with the big eyeball in it, and I knew that was his eye. And I was watching how they did what they did, and I said, no way, that's not hurting. Oh my gosh, look at that. Oh my gosh. And then when it's all done, you know, he comes out, and I said, everything good? Yeah, good. I said, holy cow, you just had things poking you in the eye, and you're doing good. We have in the studio Zora Harrison. She's the Chief Operations Officer at Ocala Eye, and Adam Tencza is the Director of Business Development, and we're going to talk to them about what they do to help us see better. And as you can tell, I'm wearing a $7 pair of glasses. Robin has regular prescription glasses, and I need to do what she did and get the regular prescription. So good morning, Adam and Zora. Good morning.
Good morning.
How are you?
We're wonderful. Thank you for having us.
Just kind of belly up to the bar a little bit because that's a little too far away. There you go. Now I hear you better. I will in a second when you talk.
Good morning.
You look too young to be there 18 years. Wow. You've been.
Yeah, I started very young.
Wow.
Let's just say that.
So does, when we say Ocala Eye, is it an all service? Do you do everything from glasses to major surgeries and everything in between?
We do. We absolutely do. So we do your comprehensive eye exam, but we also treat most medical conditions that occur in the eye. We're proud to have glaucoma and cornea specialists as well as a retina specialist.
Really?
We cover from cataract surgery all the way to the most complex glaucoma.
Has you being there so long, has it changed has the good news is good news more frequent nowadays than it was 18 years ago?
Oh, it absolutely is. I've watched the industry change significantly. Mostly, I think I've saw it change in retina. In the past, there wasn't a whole lot you could do for a patient that came in and you had to tell them they had macular degeneration, which was just devastating, life-changing for our patients.
Basically, you're telling them you're going to go blind, right?
Right. And that you're telling them there's really nothing we can do for you. And then in the last few years, we've had the addition of retinal drug injections, which help to definitely control the macular degeneration. Wow. So on the clinical side, I can't speak a whole lot about it, but I can tell you that our patients are having great outcomes, and it's just life-changing to be able to keep your independence. And that was probably one of the hardest things I ever did at Ocala Eye, is watch someone be told, you have a disease that's going to limit you.
Do we cause eye conditions? Do we do it ourselves? Does smoking cause it? Does drinking cause it? Does looking up at an eclipse cause it?
Well, that seems to be what the press was saying.
Did you hear that story about the people who put sunscreen on their eyeballs?
No, I did not.
Oh my gosh! I'm not making it up. Can you believe people thought, "Oh, this will protect me"?
Wow, that's.
And then, of course, they hurt their eyes. They had to go to the doctor.
Sure, absolutely. I don't know. We do believe that smoking contributes to some of the diseases we see. Definitely exacerbates some of the symptoms that you have. But as far as your genetics and other things of that nature, I'm not real sure how that plays in. But we like to treat each patient individually and kind of get to know them a little bit. Sometimes we do our own little internal research of why is this, if it's a unique situation or something like that. But for the most part, we always encourage our patients to try to live a balanced, healthy lifestyle.
Where are you located? Where is...
Well, we have multiple locations.
Okay, that's what I thought.
And matter of fact, we have a location just across the street from you at Paddock Park. However, our most exciting news that I'm excited to tell our listeners out here is that we sold that building. And we sold it to another local group here in Ocala that will be moving in. And we are relocating to Heathbrook. And we're going to occupy the entire space above Panera Bread.
Oh, nice. Okay. I know exactly where you mean. Oh, good. So you get your eye fixed and go down and get some bread.
Absolutely. Come there, have your eye exam, do some shopping, and it's actually quite it's just a dream of mine. We've always been the best eye practice, in my opinion. We've got the greatest doctors, but one of the things I think we were kind of lacking is the growth of some of our ancillary departments, and mostly it was space. We're an ophthalmology clinic. You don't have a big space for a hearing department or aesthetics department or even optical, but this will allow us to do that because we have so much to offer. And it's going to be much more convenient for our patients. It's going to be more convenient for our staff. So I can't even tell you how excited I am.
So this is kind of an introductory interview so that our listeners get to know both of you and know what kind of services you have to offer at Ocala Eye. I wanted to bring Adam into the conversation. Before we went on the air, you mentioned that you've got the big picture. You've got some ideas, and you're kind of new to the team. So what is your contribution, and what is the big picture? Is this part of it, the move?
Well, sure. So absolutely. On the big picture side of it, I would say, having the luxury to be with such a phenomenal team of individuals that, I've been there all of 7 weeks, but I have a support staff and a system of just strength behind 150, 160 team members that clinically it just superior to anything I've been involved in with the medical field. So what I get to focus on is different projects like patient engagement. So, what are we going to do from the beginning to the middle to the end with a patient to make sure that, we're giving them an experience. So it's not so much of, let's get them through everything that we do as it is to say, let's allow them to just have a good time, a good experience, understand that, yes, they're at a medical visit, but I think there's ways that we can step aside and give them a patient experience that they haven't had anywhere else. Mm-hmm. So clinically, I don't have to focus so much on what's happening from A to B, from A to Z. But what I do get to focus on is, things like the fitting box. This is a company out of the UK where, we've had installed iPads to where we can now take the fitting box program or software and have that in different areas of our practice, so a patient can be walking down a hallway, stop, try on all of our actual glasses that we have in stock in our optical department. So it's just ways to where it's kind of like, well, what's the point to that? And the point to it is simply an experience for the patient. So they get more involved while they're, let's say, at a 3-hour visit at our practice. Sometimes the visits can be 2.5, 3 hours long. We're going to do our own Ocala Eye channel. So, it's exciting and it's fun to think about, 9 o'clock in the morning, we're going to be spending an hour and a half creating kind of content for our patients to simply say, we love you, thank you, we're here for the community, and just, maybe trivia will be involved in that 1 week, or you name it, we're likely to do it.
We might be able to help you with that. That's so bad, all we do is trivia.
Absolutely.
And you have your own lens laboratory also?
We don't. We use some of the best in the industry. We use Essilor and Hoya and Zeiss and those. We don't have a specific lab we use. We actually try to use a lab that best fits as the patient's needs. So everyone has a different need when it comes to glasses. But having an in-house lab doesn't allow you to have all the different advanced digital technologies, and it's not a rush job. You wear these glasses every day. Some people, from the moment their feet hit the ground until they go to bed.
That's
so
me.
it's not a rush job, right? Exactly. So
That's us.
you just want to make sure that the patient's seeing the best they can, and so what we do is we make sure we have access to the best, and that's actually something that we've worked on this year because we were having some wait time issues with one of the labs. So of course we went out and we found more, and they had great turnaround times, but also had the best technology for our patients. So that's what's best for us.
Wow, it's amazing how you've grown. And do you work with children?
We do to some degree. We do not have a pediatric ophthalmologist. So if you just have a typical eye exam, our
Right.
optometrist can do. But we also would recommend if a child's having a problem, then they seek a pediatric ophthalmologist, and that's just not one of the areas that we cover.
So is there mostly people just needing vision correction?
Yeah, most of the time. I mean, the most common complaint I got as a technician, which I was for many years while I was at Ocala Eye, was I can't read the small print. That was the number one reason someone came in.
Right,
or
right.
I can't see the dashboard in my car. So that's typically why someone comes into
The
our office.
dashboard is important.
Dashboard. Yeah, you don't want to be speeding and say, I don't know if the officer would go for that one, but
Yeah, that wouldn't be good.
It's very common for a patient to typically come in for an eye exam just because they were noticing a little trouble with the TV or something like that. In most cases, the patient doesn't even come in with a real serious complaint. Now we're going to do a comprehensive eye exam, and that doesn't mean we won't uncover something that's there. But for the most part, people come in because they have a need.
And what is the recommendation as far as how often we should all be going? Is it like a dentist twice a year? Or?
Well, that's a good question. It really is age dependent. The standard of care is over the age of 65 is annual. But below that age, really, it's going to be dependent on a couple of things. If you had any kind of high risk factors, your doctor's going to want to see you annual, and maybe even more, depending on what those risk factors
How do you
are.
know if you have a high risk factor?
Well, when you come in, we do a complete eye exam. We don't, there's no patient that comes into our office to be seen without having a full comprehensive eye exam, being dilated. There's just things you uncover. So if they see something that makes you a little suspicious, maybe for glaucoma, or, sometimes even cataracts. We develop cataracts at a young age in some situations. So those are risk factors, and they say, well, we want to monitor those. But if you're if you're healthy, don't have anything going on, and you're under the age of 65, about every 2 years. Yeah.
I have a friend who seems like he has cataracts. He's got Down syndrome, and he's an adult, and he's independent.
Sure.
So I'll drop him off at Walmart, and I'll wait for him, and he'll come out, and he'll say, I couldn't find the car because of all the smoke. And I said, there's no smoke. Okay, so I put two and two together, figure he's got cataracts. Do you have to wait to a certain point do they have to be ripe? I don't know if that's even the word.
No, that's an old word.
That's
But
an old
actually,
word,
I
yeah?
hear patients say that all the time. There's insurance, obviously, guidelines you have to follow. But the main reason a patient has cataract surgery is, number one, they have a clinically significant cataract. And number two, it's impairing their life. So if I'm someone that's an artist, I may have my cataracts out sooner because I can't do that fine detail or see the fine color.
Right.
But it really is just dependent on the patient. It's actually just a conversation between the physician and the patient. Is if the cataract is the reason that we feel the vision's being limited, and you are having limitations to your daily activities, and you qualify for the surgery as far as your insurance, guidelines, then the doctor's going to offer it to you.
Is everything correctable, pretty much?
Yes and no. There are some diseases that can happen in the eye that aren't correctable, and those are usually from something systemic. But for the most part, ophthalmology is just advanced to the point where it's not too often that we have to say to someone.
It's amazing.
It is amazing. In just the 18 years I've been there, I've seen it change and grow.
Do you recommend people wear sunglasses even in the winter months?
Always wear sunglasses. Yeah, and it's not as much, in my opinion, this is my opinion, obviously you want to protect your delicate eye. It's that delicate skin around your eye that you're wanting to protect. So,
Really?
Yes, we see a lot of basal cell cancers and things like that, and, that obviously you want to make sure you protect that delicate skin.
I had that. Is that what I had?
Yes.
I had that, right? Was it here?
Yeah.
Very common on the face, yeah, very common.
And that was I could have prevented that with sunglasses?
Well, I don't know. I mean, I just know that we want to make sure we're protecting ourselves as much as possible. There's a lot of factors that come into anything like that, basal skin or other diseases, but it's just important to protect it. You are in the sunshine state, so we recommend that you either wear glasses or glasses that are sunglasses or the transition glasses.
Adam, as the business development guy, are you constantly looking for new ideas and ways to communicate to the community the different services you have to offer?
Oh yeah, absolutely. So that's the joy of my day, is getting up to figure out what's the project going to be, today, tomorrow, next week, next month. So like when I initially started talking, it was what's the big picture, and for me the big picture at Ocala Eye would be creating we'll say like a red carpet type of culture and environment from our team to the community. So you choose Ocala Eye. We're thankful that you chose Ocala Eye. But the journey kind of just gets started. So now that we started that journey, it's going to be just that, a passionate, exciting, fun journey where you are taken care of course, but you enjoy, the beginning to end of it. So I'm very, very hungry and passionate to want to create that environment with all we are so clinically strong at Ocala Eye.
Right. Does that include, like in my case with my son, I wasn't the patient, but you guys treated me like I was. Like I got the right carpet treatment. I went into a separate room where there was a TV. There was nobody else in there. I don't know if that's normal,
That's normal, yes.
but that was so nice. So how about the family members who can't be in the room during surgery and that sort of thing?
Well, so in that, I get to come into a clinically strong environment on top of a culture that's already at Ocala Eye that's been there for decades, in my opinion, that is very driven around everybody as a family. So, your son or brother or cousin, whoever it is, everybody that's on our property is going to get the same exact treatment of that culture and that passion and that, what can we do for you? Thank you very much for, of course, choosing us. But again, we're all on a journey together, all of us.
And I got a free coffee out of the deal, by the way.
Nice.
And you have locations not just in Ocala, but also in the villages?
We do. We have a couple here in Ocala. One of our older locations out on Magnolia. But yes, we have a office in the villages, and that office stays very busy. We are very grateful for our villagers.
And do you do everything down there that you do in Ocala, the surgery and everything?
We don't. We do our surgery up here in Ocala, and the main reason for that is we have a state-of-the-art surgery center, and that experience, the patients drive because of the experience they get at the surgery center.
Do you know, I wanted to ask you something. You just brought something up. Adam, you said, you were kidding me, but you said you were nervous before we went on the air.
Yes.
Okay, so my son was nervous before he was
Sure.
getting LASIK.
Sure.
Way more than you'd be before a radio show.
Right.
And you guys had this, place, this comfortable place. Or
Yes, a Zen room.
A Zen room.
It's a Zen room.
Yes.
Yeah, because we know anybody's
It was
going to be
dark.
anxious.
You could pick your
Yes,
music.
Absolutely.
Yeah.
We want you to relax, and we'd want you to. Everyone's going to be nervous, but we try to do anything we can to kind of
What
alleviate
is
that.
there a medical reason for that? Is it like is the surgery easier for the doctor if we are calm?
No.
And all zenned out?
I think that it's more for you. We really want
That's
that
for us,
patient
yeah,
to
yeah.
leave and say exactly what your son said to you is great. And if I can have a procedure and go and tell my best friend that's maybe been thinking about having that procedure, you know what, you're going to be so glad you did that. It was great. And my experience was awesome. That's really the goal. So we do what we can to try to ease our patients' minds.
Do you do emergency care also? Because sometimes people will have an accident on a job site, and they might get a piece of metal in their eye or something like that.
Yeah, for the most part we do. There's a couple of things we're limited to as far as emergency. So we don't have access to a CAT scan or an MRI. So if you had trauma where you have blunt force trauma, we're always going to tell that patient to get
gosh.
a chance, go to Shands
Yeah.
and get immediate attention at a level 1 trauma center. But if we take metal out of the eye, all kinds of things all the time, of course.
Oh my God. All the time? I'm thinking it'd be a rare thing. It
I don't
happens
think
all
it's a rare thing. I don't. I think people need to pay attention to safety a little more. But
Oh my gosh, I gotta keep my windshield on my car. Okay, let me take a little break. We've got weather and a little brief news piece, and then we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. On this Tuesday, intervals of clouds and sun with an afternoon thunderstorm in the area, high 88 to 92. Partly cloudy Tuesday night, low 73 to 77. On Wednesday, intervals of clouds and sun with a shower and heavier thunderstorm around, mainly in the afternoon, high 88 to 92. Thursday, variable cloudiness with a couple of showers and thunderstorms around, high 87 to 91. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Here is your 30-second news brief. Governor Scott has declared a state of emergency for Florida in anticipation of Hurricane Irma. A 47-year-old motorcyclist from Dunellen died after his motorcycle overturned on his leg and he was hit by another vehicle. 2 Republican candidates for Florida governor say they want Congress to take action to help those protected by DACA, and a teenager has made history in South Florida when she became the first female to ever throw a touchdown pass for a Florida high school. And that is your news brief from The Source. All right, about 6.5 minutes left in the segment. Wow, it's going fast. Zora Harrison and Adam Tencza are in from Ocala Eye. We're talking about everything that you might need to have done with your eyes over at Ocala Eye, whether it's getting glasses or surgery. I wanted to ask you real quickly, we do have a phone call, and just hang on there, listener. Let me get the button pushed here. and we'll be right on the air with you. But I wanted to ask you about eye conditions. Well, I was asking earlier about us causing the problems. And there's a commercial that runs on the network that's regarding diabetic eye something. I don't even know what they're saying.
Diabetic. There's a lot of conditions.
Neuropathy?
Is that what it's called?
Retinopathy.
For retinopathy.
Retinopathy.
So is that something we actually can prevent?
Well, that's a hard question to answer because I think that it depends on what type of diabetes you do have
Oh, okay.
and how it manifests in the body. But it is very important for a person that has diabetes to have an annual eye exam.
Okay, so that's really the bottom line.
Yeah, and you should have an
Just
annual
keep
eye exam, and the
getting it
physician will
checked.
tell you, yeah, absolutely. Is there something we need to be concerned about? But and they'll tell you the interval based on that when you should come.
Okay. If you have a question about your eye care, you are welcome to call. The number is 622-9622, and we do have somebody waiting patiently. Good morning. You're on the air with Zora Harrison and Adam Tencza.
Yes, thank you for taking my call. I just recently had cataract surgery at Ocala Eye, Dr. Jank, J-A-N-K. Was very successful. After the surgery, I do not need my glasses anymore, and both eyes are 20/20 vision. I'm very happy with the results.
Good for you. Wow.
Wonderful.
Wow. You're just calling to say you had a good experience.
I had a wonderful experience. I wanted to say at all the different centers, the Magnolia, and then off by 200, and then of course the Cataracts Mall area. The staff was just wonderful. It was a wonderful experience having cataract surgery, and I advise anybody that needs it done. It's nothing to it. And it's a great. Usually the results is just fantastic.
Wow.
Thank you so much for sharing that with us. That's what we love to hear.
Absolutely.
That's why we show up every day.
Thank you for the call. Do the colors get brighter when?
Absolutely,
yeah?
the colors get brighter. You know, whites are white and brilliant, and you know, it's.
And was it that way when we were children? It went so slowly we didn't notice it.
It's a gradual. I mean, now there are patients that have a certain type of cataract that progresses very rapidly, so they notice that. But in most cases, no, it's so gradual.
Wow.
Before we went to the break, you were referencing safety. Do you take care of safety glasses as well?
We do. Our optical shop absolutely can service that. You know, we have a couple of industries in the area that will order their safety glasses in for them. But safety is important. At work, it's kind of a given. It's I'm at home using my weed eater or mowing my yard without my sunglasses or
Oh, I
anything.
see.
Do you know, I had a moment, again, going back to my son, when we went to the Keys, we rented some masks, swimming masks, and it was the first time ever I even knew there was such thing as prescription.
Oh, yes.
And it made all the difference for him. And again, it was one of those moments like I had no idea you couldn't see underwater with a normal mask.
Oh, absolutely. Those are kind of things that we may all take for granted.
Yeah,
But we have masks specific for skiers and obviously professional dive teams.
Really?
Absolutely. So
what do you, Adam, what do you see for the future of Ocala Eye? What are you going to bring to the table? Something fun?
Oh yeah, it's always going to be fun. Hopefully, right? So
You have a hard job. I'm trying to figure out how you do your job. You must have to look around every day and say, what can we do different?
well, that's exciting though, right? That's an enjoyable aspect
That's
of
exciting,
getting up
but
every
hard.
day. I guess. I mean, I haven't worked at Ocala Eye yet. I mean, I'm there every day. Even on the weekends, I feel like I'm plugging away at some sort of project. But it's not work to me. It's an enjoyable aspect of just living my life every day and being a part of a company that is just phenomenal. Everybody from the top down, from the down up, it is perfect
And
for
you make
me.
sure that all the employees are familiar with each other, so when they pass in the hall, they can greet them by their name, things like that.
we do. We try to. I mean, our patients, they come in at the front desk, and a lot of times we don't even make them sign in. That's okay. I'll sign you in. We see these people a lot. and
Yeah.
They're just like Adam
Well, I think
says,
you're going to
it's
see
different.
me because I got to change these to those.
Yeah, you
I gotta
do.
get these.
We got to get you in there.
those.
That's right.
It doesn't bother me here, like just reading my notes here and
Yeah.
stuff. But I'll be honest, don't tell the highway patrol.
Yeah. It is life changing when you have it clear everywhere.
Progressives versus like Robin has bifocals right there, and
Yeah.
and you can hardly tell. Is there a big difference in price?
No, there's not. It's not a price difference. It's how you use your eyes. So
Oh,
the
okay,
difference with
okay.
the progressive is it allows you to see distance, intermediate, and near. And if she ever tried them, I mean, I know a lot of patients said, "Oh, I tried them; they were terrible." But the technology is so amazing now that non-adaption is just it's unheard of, really.
Oh my gosh.
It just makes a difference.
We're less than a minute away. Can you give us some contact information? Phone
Absolutely.
numbers and
Our main line is 352-622-5183. And we look forward to being here for our community, and call us anytime.
Absolutely. We have recorded this, as you know, and for the listener's sake, if you want to share this with somebody, if you have somebody who is having eye problems, let them hear and watch this video, because they will find out that it's a lot better than it maybe once was. A lot better, right?
Yes.
Adam Tencza, thank you for coming in.
Thank you.
Zora Harrison, thank you for coming in.
Thank you. It's a pleasure.
We will be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3